Ladies and gentlemen, hello and welcome to TTVNEWS broadcasted on Tay Ninh radio and television station with some last events in our province. And now we come into details. Ladies and gentlemen, in the morning of July the 8th, the Provincial Steering Committee for Disease Prevention and Control held an urgent online meeting with the Steering Committees for Disease Prevention and Control of District, Towns and the City under the chairmanship of Mr. Nguyễn Thanh Ngọc, Chairman of the Provincial People's Committee, Head of Provincial Steering Committee for Disease Prevention and Control.
In order to cope with the complicated developments of the epidemic in Ho Chi Minh City and neighboring provinces, strengthen the management of people coming from epidemic affected localities to Tay Ninh, the Department of Health has issued an official document guiding the receiving of citizens from Ho Chi Minh City and other provinces to Tay Ninh, in which it is required that citizens returning from Ho Chi Minh City and epidemic-affected localities must have a negative test certificate for SARS-CoV-2 virus and must implement isolation and epidemic prevention measures in accordance with the regulations of the health sector. At the same time, the province also plans to deploy more checkpoints and medical declarations at traffic routes connecting Tay Ninh and neighboring provinces. These checkpoints will classify people and vehicles to apply different policies. Subjects entering Tay Ninh and returning within the same day must have a negative test certificate for no more than 3 days and at the same time must declare information and schedules in the province to serve the tracing. People from other localities entering and staying in Tay Ninh do not need to have a quick test certificate, but must make a medical declaration and provide information for the self-managed population group to make a list, classify and instruct the isolation and control according to regulations. Concluding the meeting, Mr. Nguyễn Thanh Ngọc asked that the localities continue to build specific and detailed response plans with specific implementation assignments depending on the situation of each locality in the spirit of fierce concentration, coordination in direction with inspection and supervision. At the same time, it also promotes propaganda on the implementation of 5K among people, strengthen penalization for acts of not wearing masks as going to public places, regularly check suspended service, business activities and anti-epidemic measures of the services which are allowed to operate. It is recommended that people do not go to epidemic areas, those under blockade, and limit leaving the province if they do not have necessary work. From 12 p.m. on July 9, the province will start applying measures to manage people returning from Ho Chi Minh City and neighboring provinces to Tay Ninh, according to the guidelines of the health sector. Industrial parks with workers from other provinces must be responsible for managing and guiding workers to implement 5K, make medical declarations and check test papers in accordance with regulations. In the morning of July 8, the Department of Health organized to receive supplies, chemicals and biological products for COVID-19 testing donated by Saigon VRC Investment Company, Phước Đông Industrial Park, Gò Dầu District. At the ceremony, Mr. Đặng Anh Hào, Deputy Director of the company, offered materials, chemicals and biological products for COVID-19 testing to the Department of Health with a total value of 525 million Việt Nam đồng. On behalf of the Provincial People's Committee, Vice Chairman Võ Đức Trong acknowledged the cooperation and contribution of enterprise in the local epidemic prevention control and at the same time appreciated the efforts of industrial parks in controlling the epidemic control at enterprises, preventing epidemic from outbreaking in industrial parks and spreading in the community.
And coming to other news, in the morning of July the 8th of 2021, Mr. Lê Minh Hoang, Minister of Agriculture and Rural Development, and Mr. Lê Quốc Duân, Deputy Minister of Agriculture and Rural Development, co-chaired the online conference to preliminarily sum up farming production for the 2021 summer-autumn crop, implement the plan for the autumn-winter season and crop in the southern provinces, cities, And at the bridge point of Tay Ninh province, Mr. Đặng Văn Chiến, Vice Chairman of the Provincial People's Committee, attended the conference.
Implementing the motto of early sowing, the provinces and cities in the upstream of Mekong River sowed in February and March, reaching more than 309,500 hectares. In June alone, it sowed more than 214,000 hectares. The structure of rice varieties produced in each season is tending to shift to fragrant, specialty and high-quality rice varieties suitable for export market demand. The field of crop conversion still face problems. The fields of production linkage and product consumption has been still loose. Many localities have not completed the master plan on crop conversion associated with the season, the conversion area and product consumption. Attending the conference, the delegates and leaders of the southern provinces and cities discussed about advantages and disadvantages in the production of the 2021 summer-autumn season, the current situation of product consumption, the agricultural product consumption linkage in the localities. Speaking at the end of the conference, Deputy Minister Lê Quốc Duan asked localities to pay attention to seasonal issues depending on whether the area is flooded or shallow, then recommend farmers to sow suitably, not to be affected by flood. Prioritize the selection of production varieties which are fragrant, high-quality rice varieties that meet export standards, limit sticky and local rice varieties with degradation phenomenon. The goal in the seasons is to reduce production costs and improve product quality, create conditions for farmers to participate in programs to link production with product consumption. Units under the ministry continue to implement agricultural extension models, provide new technical guidance, and new variety of crops for farmers to cultivate. In the afternoon of July 8, the Vietnam Bank for Social Policies held an online conference with provinces and cities across the country to implement policies to support employers to borrow loans to pay wages of stopping working and restoring production, according to Resolution number 68, dated July 1, 2021 of the government. This resolution sets out policies to support employees and employers facing difficulties due to the COVID-19 pandemic, with a support package of 26,000 billion Vietnam dong. Accordingly, employers can borrow capital from the Bank for Social Policies at 0% interest rate. Employers are not required to apply low-earned security measures to pay sufficient salary for employees participating in compulsory social insurance who have to stop working for 15 consecutive days or more, as prescribed in Clause 3, Article 99 of the Labour Code. From May 1, 2021 to the end of March 21, 2022, the condition to enjoy this policy is that the employer has no bad debt at the credit institutions and foreign bank branch at the time of applying for a loan. The maximum loan amount is equal to the regional minimum wage for the number of employees according to the actual period of up to 3 months. The loan term is less than 12 months. Speaking at the conference, Mr. Dương Quyết Thắng, General Director of the Vietnam Bank for Social Policy, suggested that the social policy banks of provinces and cities quickly review business and units employing workers in the locality, which is eligible to promptly deploy this support package, helping them recover and stabilize production soon.
And ladies and gentlemen, medical facilities, especially district-level hospitals and health centers, are considered foster in the COVID-19 epidemic prevention and control. And during the fourth outbreak, the drastic and synchronous implementation of solutions for epidemic prevention and control at medical examination and treatment facilities has been paid special attention by the health sector of the Ninh province. Ensuring the health and safety for the patients, medical examination and treatment is normal. And thus the reported ensuring the safety against COVID-19 epidemic and medical facilities.
Tay Ninh General Hospital is the last line medical examination and treatment facility of the province. This time, epidemic prevention and control measures are tighter than ever. for medical examination and treatment, the hospital has strictly implemented epidemiological screening and patient segmentation have been implemented from the very beginning. In compliance with the directive of the Department of Health, all patients and medical staff must follow the 5K measures to ensure the people's safety from the very beginning of the gate to the hospital. We screen on patients. Secondly, patients can register for medical examination by phone number to schedule a suitable examination. During this COVID-19 epidemic, medical examination is still guaranteed. When entering the gate, we queue and take the declaration sheet. When entering the examination, we are distant according to the instruction of the doctor, nurses. The medical examination according to the order number. During the fourth outbreak, the number of positive cases with SARS-CoV-2 virus in localities across the country was many times higher than previous outbreaks. The Department of Health requested that all medical examination and treatment facilities in the whole province organize the evaluation and review the set of criteria for hospitals to be safe for the COVID-19 prevention control and acute respiratory infections, thereby proactively develop effectively declare the disease prevention control while maintaining normal medical examination and treatment activities so that people can feel secure as coming for examination and treatment. Facing the complicated situation of the COVID-19 epidemic, the Department of Health has directed hospitals to practice safety in hospitals. The second is to coordinate with the Provincial Social Insurance to deploy COVID-19 tests for patients with suspected symptoms. Next is to prepare a number of drugs and medical supplies to serve patients in general, including patients participating in health insurance in particular, to limit people going to the hospital for chronic patients. They are allowed to double prescription for more days than usual. The outbreak of COVID-19 and expressed in hospitals in some localities across the country shows that the potential risk of disease attacking medical examination and treatment facilities in the province is very large. Therefore, in order to keep the disease safe in hospitals, in addition to the efforts of the health sector, medical examination and treatment facilities, and medical staff, the cooperation of all people is urgently needed. Everyone coming to and at the hospital should follow the instruction of the medical staff, wear masks, take their temperature measurement, make a medical declaration, and keep a safe distance.
And that's all for the TTV News today. Thank you for joining us and see you next time.